right here on TRAXXfm, and today Health on TRAXX coming your way. Exactly right now we're talking about hepatitis and medicines. We have Madam Oon Hong Ying in the studio today. Otherwise she asked us to refer to her as Eska. Lovely name, by the way. Hello and welcome to the studio, ma'am.
Hi everybody, good morning.
And it's absolutely great having you here today. Today we are talking about hepatitis as well as the medicines that go with it. And you know what? Let's not beat around the bush and let us get on with the questions. Could you tell us, elaborate, what is hepatitis?
Okay, hepatitis, in fact, it is a medical term. Okay, it means the inflammation of the liver. So our liver is a big organ in the upper right side of the belly that processes nutrients, filters the blood, and fights infection, as we know. So inflammation is a tissue's reaction to irritation or injury, which results in a swelling, which the liver functions can be affected. So it is often called as silent killer. And most patients show no obvious symptoms or signs of infection. They are often unaware that the disease is chronic and leads to serious complications.
So it all revolves around the liver.
Yes.
All right. So, yeah, guys, trust me, hepatitis is something very, very scary right now. But you know what? We will break it down for you throughout the whole interview today. Eska will be telling us exactly what is it all about. Now, let's talk about the current status of the hepatitis infections in Malaysia. Tell us more about that.
Okay, in Malaysia, viral hepatitis is one of the public health concerns. It is responsible for 1.34 million deaths every year. So a recent study by the World Health Organization, which we know as WHO, shows that hepatitis contributes to the highest number of deaths globally compared to other major infectious diseases such as AIDS, tuberculosis, and malaria. And what is even sadder is that the deaths of 4,000 people daily by this virus are something actually can be prevented. This is because there are effective treatments and vaccines to prevent hepatitis virus infection.
But as you said, silent killer, right? So not many people understand that they have the hepatitis infection. You know, they only find out about it once they're super severely ill. So that is why there is a very high chance of them dying from it.
True.
So when you said 1.34 million, this is throughout the world, right? Wow, that is a very, very, very large number. So guys, if you're even under the smallest suspicion that you might have hepatitis, make sure that you go check it out. But you know what? We'll tell you more about that one once we come after the song break. But right now, another question for Eska. What are the causes of hepatitis and how are they transmitted?
Okay, in fact, for viral hepatitis, there are 5 types, mainly hepatitis A, B, C, D, and E. But the most common one, the causes for hepatitis in Malaysia are the hepatitis A, B, and C. So let's talk about the hepatitis A first, yeah? So it is the most commonly spread through food or drinks contaminated by feces, which we know that the fecal oral, okay, from one person infected with hepatitis A. It takes around 15 to 45 days to show the symptoms, and the symptoms are such as diarrhea or fever. Okay, it always can be an acute short-term disease and usually heals within 6 months. So then for hepatitis B, the major route of transmission is actually from mother to child. Okay. Other ways of the transmission include direct contact with the infected blood, needle sharing, needle stick injuries, or sexual contact. So it takes around 25 days to 180 days, which is around 6 months' time, okay, to show the symptoms such as muscle ache or joint ache, and some may not even show any symptoms. So following the exposure to hepatitis B virus, we know it as HBV, it is up to about 10% of the patient will progress to chronic hepatitis B. Okay, so it is defined as the persistence of the infectious if it is more than 6 months. Okay, so in Malaysia, about 1.1 million people are thought to be chronically infected with hepatitis B. Okay, and people can carry the virus without feeling sick, but meanwhile, okay, they can still spread the virus.
Asymptomatic.
Yes, asymptomatic. So let's talk about hepatitis C.
Okay.
So hepatitis C shares the same transmission routes as hepatitis B, primarily through infected blood. For example, needle sharing, needle stick injuries, blood transfusion, or organ transplants, especially where the tests for hepatitis were not done prior to 1992. Okay, sexual contacts, which is less common. Okay, so about 75% to 85% of the patients with hepatitis C develop a chronic liver infection. An estimation of 53,700 Malaysians in 2009 are living with a chronic form of this infection, of which 59% acquire their infection through injecting drugs. So it often does not show any symptoms. No vaccine is yet available to prevent hepatitis C.
Wow. And of course, since it's a viral fever, viral kind of deal as well, right?
Yeah.
So hepatitis C, very, very scary right there. And you know what, Madam Eska, we're going to be taking a short break.
Sure.
And once we come back, we'll be talking more about the common signs as well as the treatment that is available for hepatitis. But right now, here is Joss Stone with LOVE. We're going to be back right after this with more on hepatitis and medicines. We are talking to Madam Oon Hong Ying Eska, who is a pharmacist with Hospital Selayang. So don't go anywhere.
Be inspired, informed, and up to date. Tune in to TRAXX Momentum interview feature of the day at 11:15 a.m. Join us as we speak to our panel of guests on various topics. Health on TRAXX on Monday. Tuesday, Spectrum. Wednesday, What Matters? Face to face with our guests on Thursdays. And on Friday, tune in to W Talk. TRAXX Momentum, Monday to Friday, 10 a.m. to 2 p.m. only on TRAXXfm.
Good morning and welcome back. You're currently listening to TRAXX. This is Health on TRAXX. That was Nelly Furtado, Manos All Air. And today we are talking to Madam Oon Hong Ying, otherwise also known as Madam Eska. She's a pharmacist with Hospital Selayang. We are talking about hepatitis and medicines. As you know, there is 5 different types of hepatitis right now, which is A, B, C, D, and E, and we have already talked about A, B, and C. I think those are the most common ones right now, and also in Malaysia. And we are going to be getting on back with the questions. Now, Madam Eska, what are some of the common signs and symptoms of hepatitis?
Okay, most people with hepatitis do not have any symptoms at the beginning. So symptoms may not occur until the damage affects the liver function. So the signs and symptoms of acute hepatitis appear quickly. They could be feeling tired or weakness, nausea, stomach ache, loss of appetite, unexplained weight loss, dark urine, pale stool, yellow skin or eye, which we also known as jaundice.
So, yeah, those are some of the most common ones. And I think for children to have jaundice is still okay. But once, if you're an adult and you have jaundice, first thing, go get yourself checked out.
Yes,
absolutely.
Exactly.
Now, of course, as you know it, all sickness, almost all sickness in the world has a treatment cost for it right now. So, is there treatment for hepatitis, and where is it available, and who's actually eligible for such a treatment?
Okay, let's talk about for hepatitis A first. Yeah. So for hepatitis A, it usually doesn't require treatment because it's a short-term illness, and meanwhile, it is recommended for bed rest, fluid hydration and nutrition. Okay, so the most important also to practice good sanitation, because hygiene is a way to prevent it. And vaccine is available for hepatitis A.
Okay.
So for hepatitis B, acute hepatitis B doesn't require specific treatment. So only for chronic hepatitis B, oral antiviral medications such as tenofovir or entecavir may be recommended to suppress hepatitis B virus. So these medications are effective with very few side effects and easily been taken, meaning that just to take a pill once a day. as easy as that.
So this can also be done at home?
Yeah.
Okay.
So not all patients with hepatitis B need immediate treatment. So if you do not need to start treatment immediately, you will be monitored over the time to know when the hepatitis become more active, and then at the point you may begin antiviral treatment later on. Okay. So it is important to note that the treatment should not be stopped without discussing it with your doctor, because in some cases the virus can come back quickly, in turn causing severe liver injury. Okay?
Absolutely. Always discuss with your doctor if you're going to start a medication regimen or if you're going to stop a medication regimen. I think like some of us have been at fault for, okay, I feel better now, I can stop with the antibiotics and all of those. That's not the way to do it, right?
Definitely not.
Absolutely not.
And now about hepatitis C. So antiviral medications are used to treat both acute and chronic forms of hepatitis C. So people who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. So direct-acting antiviral, which we call it as DAA, drugs are available in Malaysia since September 2017.
Okay,
and
wow.
these drugs act by the targeting at different sites of the virus protein in order to stop the replication of the virus. So the current antivirals are highly effective and well tolerated. So they are all oral regimens with a definite treatment duration, either 3 months or 6 months, and it is relatively easy to treat with very high success rate, and thus providing hope in curing hepatitis C virus, which is known also as HCV infections in our country. So it has been reported that the percentage of hepatitis patients recovering from current drug is up to 97%. However, they still need to adhere to certain measures to reduce the risk of reinfection.
Absolutely. So guys, if you believe that you have any of the symptoms that were earlier mentioned, first things first, go get yourself checked out, and the doctor, as well as hand in hand with the pharmacist, will be able to recommend a proper regime for you to feel better. And of course, with the 97% success rate, that is quite amazing.
Yeah.
All right. So of course, let's talk about pharmacists. What is their role in hepatitis treatments?
Okay. In fact, it is a multidisciplinary approach in hepatitis treatment. So we, the pharmacists, actually involved in hepatitis medication therapy adherence clinic. In short, we call it as HepMTAC. Okay, it is managed by the trained pharmacists. We hope to increase the patient's understanding towards hepatitis and treatment. So we also will follow up the patients throughout the DAA treatment journey. So in this HepMTAC, we see patients regularly in pre-screening, initial, which is the first visit, and follow-up visits. So the pharmacists help in medication reconciliations, check drug-drug interactions, which means that between the patient's current medications with the DAA. And we also do medication counseling regarding the name of the medication, indication of duration, and then time to take, misdose management, and also the drug storage. And we also help in ensuring treatment adherence, monitoring of side effects or complications. So regarding the drug-drug interactions, pharmacists will check the drug-drug interactions between the patient's current medications with DAA. Okay, this is to ensure the drug efficacy. So patients will be advised to stop all traditional medicines, herbals, medicines such as the supplements, to avoid any potential drug-drug interactions during the DAA therapy. So all new medications prescribed must be informed to us to check for potential interactions. So for example, one of the DAA drug, which is the daclatasvir, should not be taken together with a common high blood pressure medicine named as amlodipine. So while the antiretroviral drug, the Adherence, will reduce the drug efficacy of daclatasvir, which require dose increment for that particular drug. Yeah. So the public are usually very concerned of the drug side effects. So DAA are generally well tolerated, and it has a very minimal side effects. So, the headache, tiredness, nausea may occur at the early stage, but it will subside by itself after a few weeks. So we advise patients to drink more water and to rest more. Okay, we also ensure treatment adherence. So given that the short treatment course of either 3 months or 6 months, adherence is extremely important to achieve treatment success and to prevent viral resistance. So DAA need to be taken every day. If non-adherence to regime, it may cause treatment failure, lead to longer retreatment duration or higher cost of drug treatment. So we also conduct pill counting and issue patients drug diary. We advise patients to use the compliance aids such as the pill box, phone alarm reminder, and etc.
Wow, that is a lot of work for the pharmacists as well, especially monitoring patients and also making sure that they, some patients like to, self-dose, right? They will end up with their herbal medicines on top of this. Or because this person on Instagram said I should take this for hepatitis. Guys, remember, the only person who's actually qualified to give you medicinal information is either a doctor or a pharmacist. Correct, right?
Yeah.
Absolutely. Or you can always call the National Drug Center as well. Exactly. And you know what, Madam Eska, we're going to be taking a short break. One more break. This is Katy Perry, Thinking of You. We will be back to talk about hepatitis and medicines right here. Well, welcome back. That was Katy Perry, Thinking of You, right here on TRAXXfm. And of course, we are thinking about you guys when we bring you great topics such as today, hepatitis and medicines on Health on Tracks today with Madam Oon Hong Ying, who otherwise would want to be known as Madam Eska. Now, we have gone through common signs, treatments, including eligibility as well as causes. Right now, let's talk about some of the tips that you have for the person infected with viral hepatitis, Madam Eska.
Okay, so, get an appointment with the doctor. That's the very first step.
Very first.
Yeah, you need to be checked, tested, and get it treated early if indicated. So other than that, avoid traditional medicines, supplements to cure hepatitis. Okay, and meanwhile, ask your doctor or pharmacist before taking any pain medicine. These medicines can sometimes damage the liver further. Okay, so other than that, you need to protect your family and your loved one. So screening should be done. Do not share personal items such as toothbrush, shaver, nail cutter, scissors, avoid alcohol. All these lead a healthy lifestyle. So get vaccinated for hepatitis A and B, and remember, no vaccination for hepatitis C.
All right, understood that. Hepatitis A and B got vaccination. Hepatitis C, none on the market as of right now. So of course, they always say prevention is better than cure. So how could one avoid from being infected by this virus, Madam Eska?
Okay, we know that hepatitis is a disease that can be completely prevented and treated because there is a vaccine and treatment for hepatitis B. And 97, as I mentioned just now, 97% of hepatitis C patients can be cured with treatment. So for those who are at risk of hepatitis virus infection, it is advisable to undergo hepatitis virus screening to detect the infection and then to be given early treatment if necessary. So parents are also advised to ensure that their child is given complete hepatitis B immunization according to the schedule set out under the National Immunization Program.
All right. So with that, our final question for today. What is your tip and advice to fellow listeners?
Okay, well, to my fellow listeners, up to date, the awareness of the viral hepatitis is still limited in Malaysia. So viral hepatitis continue to be a public health challenge in our country. It has been committed towards eliminating viral hepatitis by 2030. However, majority of the people living with viral hepatitis are unaware about their status, and if left undiagnosed, it can be deadly. Thus, I would like to urge the public to get tested and get it treated early. And lastly, I would also like to take this opportunity to promote World Hepatitis Day. It is held on 28th July every year. The theme of this year's World Hepatitis Day is Hepatitis Can't Wait. It is a day to raise awareness of the importance of knowing your hepatitis status and to spread the word about treatment. There will be a public awareness event on hepatitis held at Selayang Hospital on this coming 29 July 2022, which is this Friday, 9 a.m. to 2 p.m. 200 free screening tests for hepatitis B and C virus will be offered. It is on a first-come, first-served basis. And also free doctor consultations, pharmacists and dietitians counseling booth. Okay, so, and also, last but not least, please call National Pharmacy Call Center, NPCC, through 1-800-886722, Monday to Friday from 8 a.m. to 5 p.m., except public holiday, if there are any inquiries regarding the use of medicine. So let's go together.
Absolutely. So Hospital Selayang this Friday, there's going to be a very, very big event. So of course you can meet Madam Eska there as well.
Yeah, sure.
Right. So guys, go get yourself checked out. Make sure that you know what, your body is running in great condition. And of course, is there anything else that you would like to add for our listeners? None.
Awareness is still the best.
Awareness is still the best. Lovely. And thank you so much, Madam Eska, for coming in today and helping us understand what is hepatitis, what are some of the options that they have, what is severe, what is not severe, and what's acute, what's chronic. Thank you so much for that. And with that, it's a big thank you to you. And it's about time that Momentum got on back with their music. Alrighty? Thank you so much, Madam Eska. We talked about hepatitis and medicines on Health on TRAXX. Today, see you guys next week.